Hello, dear students. My name is Medvedeva Anna Valentinovna. I am the assistant professor in the department of Saratov Medical State University, and today I will describe you the new theme about rheumatic diseases or systemic diseases of connective tissue, or second name collagenoses. What are rheumatic diseases? A group of chronic diseases with systemic progressive disorganization of connective tissue and vessels, as well as immune derangements. Which nature of those diseases? Infectious, allergic. Which risk factors? Hereditary, infection, beta hemolytic streptococcus, hypothermia, and some medicaments or drugs. Which general signs of those diseases? With the presence of chronic infection foci, the tonsillitis, streptococcus infection, immunologic homeostasis derangement. So we see appearance of antigens in the tonsillitis. Those antigens look like as the antigens of our tissues, our connective tissue. Generalized vasculitis, chronic undoubting course, and systemic progressive disorganization of connective tissue. We told about disorganization of connective tissue in the theme about stromal vascular disorganization. Which nosological forms of rheumatic diseases? There are first and main disease is rheumatism. The next, rheumatoid arthritis, systemic lupus erythematosus, scleroderma, nodular periarteritis, Bechterew disease or spondyloarthritis, and dermatomyositis. More information I will tell you about rheumatism. I repeat, stages of connective tissue disorganization. We told about those stages in the start of our pathological anatomy subject. First stage, mucoid swelling. This reversible stage. The next, fibrinoid changes, the fibrinoid swelling and fibrinoid necrosis. The next, appearance of inflammatory cells around zones of necrosis or inflammatory cellular reactions. And the next, rough sclerosis. Which localizations of and affections due to different diseases, rheumatic diseases. Due to rheumatism, we see affected of heart and vessels at first. Rheumatoid arthritis. Arthritis means joints, small joints. Systemic lupus erythematosus, skin and kidneys. Scleroderma, skin. Nodular periarteritis, arterial wall. Bechterew disease or spondyloarthritis, articular ligamentous apparatus of the spine. Dermatomyositis, skeletal muscle and skin. And first information about rheumatism or rheumatic fever or rheumatic endocarditis is a chronic disease of infectious allergic nature with the progressive disorganization of connective tissue and vessels. I told you that etiology of rheumatism is beta hemolytic streptococcus of A group. I repeat connective tissue disorganization stages, but due to rheumatism. First, mucoid swelling. The next, fibrinoid changes, fibrinoid swelling, fibrinoid necrosis. The next cellular reaction, we see formation of granulomas in the heart, in the connective tissue. At first blooming, the next fading, and the last sclerosing. With special name, Ashov-Talalaev's granulomas. And the next we see rough sclerosis. Which clinical anatomical forms of rheumatism? First and main form is cardiovascular, predominant affection of the heart and vessels. Polyarthritic, affection of heart, vessels and joints. The next, cerebral, the affection of the heart, vessels and brain. And nodose, affection of the heart, vessels and skin. And first information about cardiovascular form. We see affected of vessels, appearance of vasculitis. Affected of endocardium leads to endocarditis. Myocardium, myocarditis. Pericardium, pericarditis. And we can see combination. As example, rheumatic heart disease, combined affection of endocardium and myocardium, endocarditis and myocarditis. Pancarditis, inflammation of all heart membranes. Endocarditis, myocarditis and pericarditis. What about endocarditis? More often we see affected of endocardium. Classifications according to the localization: parietal, chordal and valvular. According to the morphology, we see 4 stages: diffuse endocarditis or diffuse valvulitis. We see mucoid swelling in this stage. The next, acute verrucose. Verrucose. What's this verrucose? Verrucose means appearance of thrombi in the endocardium or in the valves. Acute verrucose means we see appearance of necrotic zone and rough surface of endocardium and valves. As a result, appearance of thrombi. Acute means we can't see rough scarring. The next stage, fibroplastic. In this stage, we see rough deformation of valves of endocardium as a result of rough sclerosing after all stages of disorganization of connective tissue. And the next, we see repeating of all stages of disorganization. As a result, what can we see? Recurrent verrucose. So we see rough sclerosing, we see rough scarring, we see rough deformation of valves and endocardium with fresh, new thrombi. Which outcome of affected of valves and endocardium due to rheumatism? Heart disease formation. Look, in this picture you can see first and second stage. This acute verrucose and maybe diffuse valvulitis. Acute verrucose with the appearance of thrombi in the valves and we can't see deformation of valves. In this photo, you can see recurrent verrucose endocarditis. We see rough scarring, rough sclerosing, deformation, affected of valves, and appearance of fresh or new thrombi. Recurrent verrucose endocarditis, valvulitis. In this photo, you can see histological examination of recurrent verrucose endocarditis. Number 2, zone of necrosis. Number 1, cellular reaction. Number 3, cellular reaction, and in the end of valves, we see formation of thrombi, fresh thrombi. What about heart diseases? After rheumatic diseases, we see formation of acquired form of heart disease, but maybe, according to the origin, congenital in the childhood and acquired more often after rheumatic endocarditis. According to the morphology, we can see stenosis, insufficiency, and combined heart disease. And third classification of heart disease may be isolated, associated heart disease. Isolated in single valves, associated in the many valves. In this photo, you can see stenosis is a result of rough scarring, deformation, insufficiency, and artificial valves after operation. Artificial valves. The next form of rheumatism, myocarditis, cardiovascular form of rheumatism, myocarditis. There are three main forms. Productive with formation of granulomas, of Ashov-Talalayev granulomas. Interstitial, exudative, diffuse and focal, with formation of many cells of interstitial inflammation between cardiomyocytes. As a result of all forms of myocarditis, we can see cardiosclerosis. So in this photo, you can see formation of Ashov-Talalayev granuloma around small vessel. Ashov-Talalayev granuloma. Diffuse interstitial myocarditis. Local, focal interstitial myocarditis. The next affected of cardiovascular form of rheumatism, pericarditis. According to the morphology, maybe cirrhosis, fibrinose, and cirrhosis-fibrinose combination. Due to cirrhosis, what can we see? We see appearance of liquid, cirrhosis liquid in the pericardial cavity. Due to fibrinose inflammation, we see formation of villofibrin in the pericardium and formation of hair heart, ville heart. And outcome of fibrinose and cirrhosis from fibrinose forms of pericarditis, formation of commissures and obliteration of pericardial cavity. Cirrhosis liquid, more often we see lysis of cirrhosis liquid and favorable outcome. In this photo, you can see cirrhosis fibrinose form of pericarditis. Fibrinose form of pericarditis, the hair heart. Fibrinose pericarditis. Histological examination of fibrinose pericarditis with the formation of villi of fibrin. Which complications of cardiovascular form? As a result of varicose forms, we can see thromboembolism. And after thromboembolism, many infarctions in the kidneys, spleen, brain, heart. Vascular thrombosis and appearance of necrotic zones in many organs. Cirrhosis in the organs and venal pneumonia. Which cause of death due to cardiovascular form? Heart decompensation and general blood circulation disturbance. Chronic venous hyperemia. Specific and non-specific pneumonia is a cause of death. Cerebral hemorrhage and intercurrent diseases. We talked about cardiovascular form of rheumatism. The next short information about polyarthritic form of rheumatism. This form is found in the 10–15% of patients. What can we see? We see large joints are affected. Which inflammation pattern? Serous without the lesion of articular cartilage. More favorable form. Heart and vessels are affected to a lesser degree. Important. Has to be differentiated with rheumatoid arthritis, but due to rheumatoid arthritis we say affected of small joints in the hand and feet. The next form of rheumatism, nodose or nodular form. This form more often is found in the childhood. Connective tissue disorganization along the tendons. Development of nodose erythema. Outcome, scarring of the skin. There are similar changes in other organs, but without the clinical manifestation. More favorable form. In this photo you can see nodose form of rheumatism, zone of necrosis with cellular reaction around fibrinoid necrosis. And the last form of rheumatism, cerebral form. This form is found in childhood too, juvenile chorea, with the affected of cells in the spinal cord, with the vasculitis and degenerative changes in the brain cells. Other organs are changing less. This favorable form too. The next disease, the next rheumatic disease is rheumatoid arthritis. Short information. More often is found in the women and children. Etiology: beta hemolytic streptococcus of B group. We see appearance in the blood rheumatoid factor. What's this rheumatoid factor? Those immunoglobulins MGA, combination of those immunoglobulins. Small joints of hands and feet more rarely are affected. Which anatomical changes due to rheumatoid arthritis? There are 3 stages we see due to this disorganization of connective tissue. First, in the joint cavity, we see a combination of serous liquid, accumulation of serous liquid. The cartilage is extant, areas of mucoid and fibrinoid spheres, with necrosis and formation of villi, compact casts. Rice bodies are formed. Villi overgrowth and cartilage destruction in the second stage. Excurrence of granulation tissue, formation of pannus. In the third stage, we see formation of fibroosseous ankylosis. Look, in this photo, you can see a formation of rice bodies. Rice bodies to anatomical changes. And rough deformation in the third stage in the hand with ankylosis formation. The next information about systemic lupus erythematosus. What's this? This disease of connective tissue more often is found in the young women and children. Etiology: viruses. What can we see? We see effects of skin, vessels and kidneys. In the skin we see appearance of subacute dermatitis as a butterfly in the nose and the skin down to orbitus. In the kidneys we see glomerulonephritis, lupus glomerulonephritis with immunological components. In the vessels we see vasculitis of macrocirculatory systems. In the heart, abacterial verrucous endocarditis. In this photo, you can see lupus erythematosus butterfly in the face skin. In this photo, you can see glomerulonephritis. This immunologic changes due to glomerulonephritis. The next, Behçet's disease or spondyloarthritis. What's this? In this disease, we see affected of young men. Which etiology? Heredity and chlamydia infection. Articular ligamentous apparatus of the spine is affected. Information of ankylosis. The spinal column is getting similar to bamboo cane. Besides, the heart and lungs can be affected with formation of sclerosis in those organs. Look, in this photo, you can see progression of Behçet's disease in single man. Deformation of spine. The next disease, systemic scleroderma. What's this? Affected of the skin. Which etiology? Heredity and viruses. The effect of skin and some internal organs, joints, renal vessels, heart, lungs. Formation of sclerosis with the following insufficiency of the organs where sclerosis has developed to the maximum. Look, in this photo, you can see systemic scleroderma in the patient with affected of skin of the hand, affected of skin in the face and hand. The next, nodular periarteritis. What's this? Etiology is unknown origin, with the affected of arteries. In which organs? In the kidneys, about 90 and 100%. Coronary vessels, 88–90%. Mesenteric arteries, 60%. Hepatic and cerebral arteries, about 50%. This disease basis is vasculitis and outcome of this disease rough sclerosis. Which course? Acute, subacute and chronic. In this photo you can see affected of small vessels, arteriitis in the hand and formation of gangrene in the end of fingers. In this photo you can see affected of many vessels and formation of marble skin, special name. Marble skin too, with zones of necrosis and formation of ulcers. And the last information about dermatomyositis. What can we see? We see affected of skin and skeletal muscle. In the skin we see dermatitis and affected of muscles, skeletal muscles, mechanical hand. That's all. Thank you for your attention and see you in the next lecture.